video, I'm going to talk about gait training or walking with crutches. So one of the things I forgot to mention in my video about sizing assisted devices or crutches is that one thing I never appreciated as a physical therapist until I was a patient is that once you put on shoes, you add about an inch to your height. And all of a sudden, if you saw my video on crutch sizing, suddenly you realize that crutch is lying quite a bit, that bar is lying quite a bit lower than my wrist bone. And when I stand with the crutches at my side, my elbow's almost straight. That actually makes it very inefficient to walk. You can see when I step, I don't really have anything to push through. So I was actually telling a physical therapist the other day, and she goes, "Oh my gosh, I never thought about that." I said, "I know, me either. I crutch trained people for years and years, and I never thought about what happens when they leave the hospital and they put on their shoes." So what I've learned is that when I'm wearing sneakers, I have to add an inch to my crutches. And it's just kind of a pain because then when I come in the house and I kick off my shoes, I've got to make them shorter again, but totally worth the effort. You can see now my wrist is hanging. I've got the handhold, the grip at the level of my wrist bones. When I hold the crutches, I've got that nice 30-degree bend in my elbow. So I'm going to start just from back here. Backwards walking is not actually part of this. So when you go to walk with your crutches, what you want is your crutches are going to come first, followed by your operated side. I had surgery on my left leg, so this is the side I'm trying to offload. And when this foot comes forward, you really, if your surgeon says, "I only want you touchdown weight bearing or toe touch weight bearing or putting 20% of the weight through your foot," you really don't need to put much through that foot at all, maybe just a tiny bit for balance. And then you're pushing with your elbows, so you're not hanging on your armpits, but you're pushing with your elbows and you're bringing this foot to meet it. So crutches, bad foot, good foot. Crutches, bad side, good side. And when I say bad side, if you saw my stair videos, I'm talking about the side you had surgery on, maybe your weaker side, maybe your more painful side. But when you're using two crutches, bad leg, pushing with those elbows, good leg. Now what I'm doing here, what you're seeing is something that in physical therapy we call a step 2 gait pattern. And when I say step 2, what I mean is your crutches are coming, you're stepping, and then you're bringing your good leg to meet it. And this is just nice and safe and slow. This is how I always recommend patients walk when they're in the hospital, when they've got a lot of pain, when they've got some dizziness, balance. You just want nice and easy. This is very gentle on the leg. As patients get a little bit stronger and more confident on crutches and get a little bit further removed from surgery, or if you're not having surgery, people often do what we call a step through gait pattern. With step through, what you're doing is your crutches, your bad side's coming through, but then your good leg's actually walking past it, just like you would with normal walking. And when you get coordinated, generally the crutches are moving with your operated side or your painful side, but your bad side. So you actually get to the point that you can walk pretty fast. So you can see the crutches are always going with my surgery side, but I'm able to actually do a pretty normal walking pattern. Once again, backwards walking is not part of this. But sometimes people after surgery, though, really struggle to advance that surgery side, and they really, they're having a lot of pain, or they're having some weakness, or maybe in the hospital sometimes they use certain nerve blocks that limit how well you can move your foot, or an epidural. So what I sometimes encourage for patients, if that's the situation, some different tricks that you can do. One is to put a shoe on your side, on your good side. And what this does, you can see this actually raises me off the ground on that side, and that way I literally can just touch with my toe. You can just kind of touch down and bring that good leg. So this is kind of a toe touch weight bearing pattern, but I see that a lot of times with people if they have some pain in their hip. And it also just makes it a little bit easier to clear that foot if that leg's really not moving. The type of walking I'm doing going forward here, this is literally like non-weight bearing on this side. Honestly, that's unless your surgeon wants you non-weight bearing, that's actually kind of stressful on the front of the hip here on your hip flexors. So really it's actually ideal if you can get some weight through that foot. Once again, as long as it's allowed by your surgeon. So that's a really good trick for moving.